While drug shortages are paralyzing Angola's health service, crippled by 27 years of civil war, healthcare improved after the conflict ended in 2002 as the oil-fueled economy surged and new hospitals and clinics were built. But experts say the country has failed to develop a robust system for buying and distributing medicines or training doctors and nurses. Worldwide tuberculosis has been declining, but according to the World Health Organization, Angola saw a 16% rise in TB cases between 2002 and 2016. The Southern African country suffered a devastating yellow fever epidemic in 2016 with about 4,000 suspected cases and 380 deaths. Angola's new president, João Lourenço, has vowed to improve public services, particularly healthcare, which the government acknowledged suffers from a lack of doctors and medication. Now, about 20 years ago, scientists started finding genetically similar viruses in very different environments and different locations around the world. Now they know why. Faith Lapidus explains.
The arid Sahara Desert is actually teeming with life, microscopic life. But those microbes don't stay in the sand. Millions of types of virus and bacteria, including deadly varieties, are being swept high into the atmosphere on small particles of desert dust and carried halfway around the world. An international team of scientists has now detailed the long-range dispersal of these microbes.
So if you have some viruses in the Saharan Desert, they can be traveling to the Amazon just because these atmospheric currents, or you have some viruses from the surface ocean that can reach Europe.
Researchers built platform sites high in Spain's Sierra Nevada mountains, where they found tens of millions of bacteria and nearly 1 billion viruses being deposited per square meter daily. They discovered that most viruses showed signatures of being swept up into the air from sea spray, hitching rides on smaller, lighter organic particles suspended in air and gas. They stay aloft in the atmosphere for long periods before being returned to Earth through rain and dust storms.
The important thing of our work was like we show this number is not small, it's really big, and that could be a way to contribute to this result that you can find similar, identical, almost identical viruses in very different places and in very different conditions.
The study, published in the International Society for Microbial Ecology journal, offers further proof of our intricate, interconnected world. I'm Faith Lapidus, VOA News.
It seems like there's always another dating app popping up with promises of helping people find romance. But one new online dating service is incorporating genetics into the mix. Deanna Mitchell has this report.
Love from a cheek swab? That's what founders of a new app are promising.
What if I told you that with this genetic cheek swab, I could tell you who you'd be attracted to and who's going to be attracted to you based on your cheek cells? Well, I'm a data scientist.
And I'm a geneticist. And there's over 40 years worth of research showing that there's 11 genes responsible for attraction.
They're calling the app Pheromore, a cross between pheromone, the small molecules that are emitted from the body and are smelled by the people around us, and amour, the French word for love. Their app, which launched earlier this month, came in second at a recent tech event called Startup Grind.
Pheromore looks at genetics-based human attraction and social media metadata to help people increase their efficiency of dating.
Pheromore hones in on 11 genetic markers collected from that cheek swab that they say have been proven by scientists to be responsible for attraction. But one scientist at UC Berkeley isn't buying it.
Our ability to predict anything from genetic data is relatively poor, and something like mate choice, who you are attracted to, we really can't predict that at all. So when people are trying to sell genetic prediction for mate choice, it's to a certain degree selling snake oil, because we can't really do it. The genetics is not worked out well enough yet.
But the founders stress that the app doesn't just look at genes. It pairs the genetic information with your social media activity to get a fuller picture of your personality and interests.
So you download the app, you purchase the kit, you instantly start to match with local singles based on the metadata from social media. When you swab your cheek, you send it back to us. It takes about 2 weeks, and the genetic information will just enhance the compatibility scores.
In addition to finding romance, the company says Pheramore is also saving lives.
The same 11 genes that we look at for attraction are used to fight blood cancers.
We have a partnership with Gift of Life, which is a national cancer registry. We ask all of our users if they'd like to consent and be part of the registry. This means if they're a match for someone with leukemia, lymphoma, or other blood disorder, they may be contacted at another time.
The DNA test costs $19.99, then it's $10 a month for the service. Perhaps a small price to pay if their science can lead to love. Dina Mitchell for VOA News, Redwood City, California.